Ozempic stroke prevention, new scientific findings. A groundbreaking discovery reveals that GLP-1 drugs like Ozempic may offer a new layer of protection for your brain. Recent studies suggest these medications could reduce the risk of stroke and improve recovery outcomes, a finding that's equal parts surprising and promising. Imagine a medication that not only helps manage diabetes and obesity, but also guards your brain against the devastating effects of stroke. That's exactly what researchers are exploring with GLP-1 inhibitors, a class of drugs that includes the popular medication semaglutide, better known as Ozempic. In a trio of studies presented at the 22nd Annual Meeting of the Society of Neurointerventional Surgery, SNIS, scientists delved into the potential of, but here's where it gets even more intriguing. Ozempic users also had a significantly higher chance of surviving their strokes long-term. The second study took a different angle, examining emergency department records to uncover associations between Ozempic use and reduced odds of stroke. The results were clear. Potential Ozempic users had a significantly lower risk of experiencing a stroke. This finding alone could change the game for stroke prevention. But the third study might be the most controversial of all. Researchers investigated whether GLP-1 inhibitors could improve outcomes after brain hemorrhages and strokes. The results were striking. GLP-1 inhibitor use was linked to a reduced risk of cognitive side effects, seizures, future brain hemorrhage, and even death after brain hemorrhage and stroke. It's a finding that challenges our understanding of these medications and their potential benefits. Of course, more research is needed to fully understand the implications of these studies. But one thing is clear. The potential protection offered by GLP-1 drugs like Ozempic is a fascinating and promising development. It could introduce a new perspective to the discussion of preventing and mitigating the devastating effects of stroke and related brain injuries. So, what do you think? Could GLP-1 inhibitors be the key to unlocking a new era of brain health? Or are there still too many unanswered questions? Let us know in the comments below. GLP-1s versus Metformin. New study reveals reduced dementia risk. Could a common diabetes medication hold the key to reducing dementia risk? A groundbreaking new study suggests that GLP-1 receptor agonists might offer more protection against dementia in people with type 2 diabetes than Metformin, the long-standing first-line treatment. This discovery could reshape how we think about managing diabetes and its associated risks. But here's where it gets controversial. Does this mean we should reconsider our entire approach to diabetes care? Published in DMJ Open Diabetes Research Care, this research marks the first time scientists have directly compared GLP-1s and Metformin in terms of their potential impact on dementia risk. To arrive at their findings, the researchers sifted through electronic health records from over 98 healthcare organizations, spanning nearly 2 decades. Their focus? Adults with type 2 diabetes who had started either GLP-1 receptor agonists or Metformin as their initial treatment. By applying advanced statistical techniques to control for confounding factors, they were able to analyze data from more than 174,000 patients, evenly split between the 2 treatment groups. So, what did they find? The results revealed a modest, yet statistically significant reduction in dementia risk among those treated with GLP-1 receptor agonists. Specifically, these patients experienced a 10% lower risk of all-cause dementia compared to those using Metformin. The benefits were particularly evident for Alzheimer's disease and other non-vascular forms of dementia, though no noticeable difference was observed for vascular dementia. But here's the twist. The advantages of GLP-1 therapy weren't uniform across all groups. Older adults, women, and certain racial subgroups appeared to benefit more significantly. Additionally, the study noted that GLP-1 users had lower overall mortality rates, A finding. Could it be that patients living longer simply have more time to develop cognitive symptoms? This possibility raises important questions about how we interpret the results. From a scientific perspective, the mechanisms behind GLP-1's apparent neuroprotective effects are fascinating. These drugs are believed to cross the blood-brain barrier, potentially reducing neuroinflammation, improving insulin signaling, and even altering amyloid and tau pathology, all processes implicated in dementia development. Metformin, on the other hand, works primarily through systemic metabolic pathways, which may explain why its impact on dementia risk appears less pronounced. Shiona Scales, Director of Research at Alzheimer's Research UK, weighed in on the implications of the study. Research shows that nearly half, 45% of dementia cases are linked to 14 risk factors, including type 2 diabetes, she explained. While recent studies suggest that some diabetes medications could help reduce dementia risk, it's still unclear which treatments are most effective. This new study adds valuable evidence that GLP-1 medicines may play a role in lowering dementia risk. Despite these promising findings, the authors caution against jumping to conclusions. They stop short of recommending immediate changes to treatment guidelines, but emphasize that their work should inform future clinical research and policy decisions. As they put it, given the severe societal, familial, and economic burden of diabetes-related dementia, these findings raise important considerations about the role of GLP-1 receptor agonists as first-line therapies in type 2 diabetes management. However, not everyone is convinced. Patrick Kehoe, Gestetner Professor of Translational Dementia Research and Director of the Elizabeth Blackwell Institute for Health Research at the University of Bristol, pointed out a critical limitation. Most GLP-1 drugs remain under patent protection, making them more expensive and less accessible in countries with public healthcare systems. Could socioeconomic factors, such as better access to nutritious food, exercise opportunities, and education, be influencing the results? If so, the favorable outcomes attributed to GLP-1s might not solely reflect the drug's efficacy. Martin White, an associate professor at the University of Surrey, echoed concerns about the study's methodology. He noted that the authors didn't provide detailed information about patient characteristics before or after statistical matching. Furthermore, treatment duration for both GLP-1 drugs and metformin wasn't reported. While these gaps make it challenging to draw definitive conclusions, White acknowledged that the findings contribute to growing interest in the cognitive benefits of GLP-1 drugs. Several randomized controlled trials are currently underway to explore whether these medications can indeed reduce dementia risk. And this is the part most people miss. The debate isn't just about GLP-1s versus metformin. It's about how we balance cost, accessibility, and effectiveness when developing treatment strategies. Should governments and healthcare providers prioritize funding for newer, pricier drugs if they show promise in preventing devastating conditions like dementia? Or should we focus on optimizing existing treatments? The full study is available online for those eager to dive deeper into the details. But before you go, here's something to ponder. If you had type 2 diabetes, would you advocate for broader access to GLP-1 drugs based on these findings? Or would you wait for more robust evidence? Share your thoughts in the comments. We'd love to hear what you think.